Okay, well, I would like to begin by just letting everybody know that this session is about access to mental health in Western Canada. And it is my pleasure to introduce and welcome our wonderful presenters, Jaime Mantesso and Jacqueline Nelligan. Jaime is a registered nurse and a member of the University of Regina's Faculty of Nursing. Jaime is also a founder and president of the Mental Health Professional Practice Group, and she sits on the board of the Schizophrenia Society of Saskatchewan. Jacqueline is an executive director of the Ladysmith Family and Friends organization in Vancouver Island. Jacqueline's organization supports some of the most vulnerable families in the region through its family resource programming. The organization provides access to health services, food security initiatives, and creates opportunities for social inclusion. So Jaime and Jacqueline, thank you for making the time to be with us today, for sharing your insights, for sharing your knowledge. Welcome to our conference. Jaime and Jacqueline will present for 15 minutes, and then we will break up in groups for the discussion portion of this session. Please know that only the presentations will be recorded. We will not be recording the discussion to allow for a more free-flowing and sincere conversation. So Jaime, I will pass the torch to you to tell us a little bit about your research.
Thank you. I'm just going to share my screen here. So good afternoon. My name is Jaime Mantesso, and I'm a faculty member with the University of Regina Faculty of Nursing. And I'm also a doctoral student, and I'm going to be presenting kind of from that lens, from being a doctoral student and some of the research that I've been doing, as well as, I guess, a nurse educator and a step parent to two 13-year-old twin boys. Where I work and learn is situated on Treaty 4 and Treaty 6 lands, which is territories of the Cree, Saulteaux, Dakota, Lakota, Nakota, and homeland of the Métis Nation. And while there's diverse peoples on the lands today, they're incredibly vital, and some of the literature supports just how incredibly important nature and being outdoors is, specifically with this pandemic and with what parents were telling me. So there we go. So I'm going to talk a little bit about the background and the context and kind of give you some numbers and stats. Then I'll just I won't bore you to death, but I'll go a little bit into some of the highlights of the findings and kind of why I decided to choose the topic I did. And then I'll also talk just briefly about the mental health professional practice group. And Jacqueline's going to have a lot more to say about kind of some of the philanthropic community supports that could be potentially out there, or maybe we can kind of develop different ones for some of the folks in Saskatchewan. So just a bit about the context. I mean, these are just some of the numbers that I actually got from the CMHA. So 1/5 of Canadian youth will have a mental illness or signs and symptoms of a mental illness every year. 1/3 receive inadequate care or don't seek care at all. And 50%, and this is significant, 50% of people who look back retrospectively have had signs and symptoms of a mental disorder before even hitting adolescence, and 70% before adulthood. So that's kind of some of the reasons why my study focused on preteen children, so kind of between that 8 and 12 year range. We know that children who develop mental health struggles endure kind of, during these fundamental years, endure kind of long-lasting impacts, specifically when they aren't seeking care or care is not adequate for them. We also know that in Saskatchewan, we have, it's very spread out, as is most of Canada, and we don't have a number of resources and in the amount that we need to kind of address some of these issues currently. And I think our keynote speaker spoke to some of that earlier this morning. So when a child does develop a mental illness, there's a wide ranging functional impairments that do show substantial kind of staying power into adulthood. And so really starting early is pretty important, and looking at ways that we can build on people's mental health And then also when it comes to having, you know, mental health challenges, addressing them as they pop up for sure. So when I went to do my study, one of the things I wanted to look at was what parents' perspectives. As a new parent, as someone who did develop mental illness in their preteen years, I kind of wanted to understand that context better, specifically coming into a family where there's already 2 8-year-old children that had gone through some pretty difficult times. So I wanted to look at all areas of kind of mental wellness and how I could be a part of contributing to their mental well-being. So I decided to conduct a constructivist grounded theory inquiry to really capture what parents' understandings of mental health was, as well as how they strategize and how they think about their children's mental health and overall well-being. Some of the concerns immediately came up were peer relationships and worried about children, specifically, you know, that they're maybe not engaging with their friends as much as parents remember engaging with their friends, you know, maybe being on technology more or not being in home more. Other things that came up were being overscheduled, so they didn't really have time to go and play, just be kids and play, always having something structured to do. Another concern was around technology and social media, and that was a big one for parents. And I think some of that might be that, you know, Gen X and for older millennials like myself, we didn't necessarily grow up in a digital world where we would be online or interacting that way. We'd always be, you know, going down the block to our friend's house. Another thing was accessing care, and that was discussed a bit this morning and kind of one of our big overarching topics of the conference. And parents often discussed noticing that their children needed help, and then kind of gave us some stories about when and what they did and how it kind of worked out for them. So some of the things that they said is, why would you watch someone play? Like, go outside and play. And if anyone has children, middle age, actually children right across the board, I'm sure you've seen them watch YouTube where they're watching somebody, say, build a Lego tower instead of playing. So parents were expressing frustration with that. Another big one is, as you can see, Grace, it says it's not public, right? It's private. So there was numerous stories about trying to access care and the lengthy wait lists, as we know. Also things that I didn't consider, but I'm sure a lot of you might have already considered them, would be around, you know, not having access to care. So one of the families that I was speaking with, one of their children had specific, pretty significant mental health needs, and it would take them an hour and a half both ways driving once a week for one appointment, same thing for another appointment. And the cost even just to have the care was $140 a visit, which it can get quite expensive. So it wasn't only the fact that we don't have enough mental health professionals, or that, you know, people are accessing them at greater numbers. It was also just the cost. And I think that's something that is a challenge for many people. And then the other one, Mary had said, I worry with COVID now. She had trouble with making friends before, but this was at the very outset of COVID when I spoke with Mary. And I can only imagine now what the barriers with people being, I mean, now we've had multiple bouts across all of Western Canada, all of Canada, of schools shutting down and of people being further isolated. And so these were kind of some of the things that came up. And there's many more, but to keep brief. One of the things that I wanted to do as part of my studies was looking at, I recall this morning, Lindsay Richardson had said there's no single bullet solution. So when talking with parents, I wanted to understand, you know, changing from a paradigm of pathogenesis to more of a salutogenic focus. And for those of you that might not know what kind of salutogenic thinking or that lens would be, it's a complementary approach to the pathogenic paradigm that is largely what our health system is built on. we often talk about mental health promotion, but it's really we're conflating the idea with prevention and kind of not as upstream thinking as perhaps we should be thinking. It's difficult to talk about it now because we are in a crisis with the COVID pandemic. So I don't want to make light of anybody's struggles or suggest that we should just think about self-care and it will be lovely. So some of what I'm going to say is keep that in mind. So accessing supports and stuff is obviously very important, and but it happens when people are more at a crisis point. So what I wanted to look at was how parents promote their children's mental well-being, despite whatever kind of end of the spectrum they're on, and we're all going to experience mental health challenges at some point. So where the pathogenic approach kind of to mental health care focuses on illness, disease, disorder, and kind of works to mitigate or lessen the risks or avoid them altogether. A salutogenic focus would emphasize moving people where they're at to better kind of mental wellness. Recognizing that life is stressor rich and we're all in a state of entropy, we're kind of looking at the mental health assets that we already have and how we can better utilize them. So a salutogenic approach to mental health or health promotion in general, Antinoski is kind of he spearheaded everything, he's since passed. These are a couple of quotes, but the one is, how can we move this person wherever they are to greater health? So he did a lot of research on Holocaust females that survived the Holocaust and was wanting to know why some people kind of declined quite significantly and had post-traumatic stress, all those kind of things after the Holocaust, and why some women went on to lead healthy, happy lives. So that's kind of where some of this stemmed from. And that is one of, there's been numerous other instances of great tragedy, and why would some people kind of have that growth after it, and why others end up getting much sicker. So after looking at those kind of things, what parents said, so initially they were focusing on kind of some of the problems, and then looking at what are some of the things that are going well. Even children, some of the children in the study had mental health challenges for sure. Some were diagnosed, some were still waiting for care, some parents, so it was quite a mix. But they started to say things like how much the school's been influential, and schools really have started doing mindfulness, doing so many different things. They started talking about what they do around sleep, that some of the things around time, like how spending time with people, they wanted to have good people, raise good people. And so some of the things that kind of we built on from there is what can they do or where can they go? And a lot of parents didn't know where to go for reliable resources. So while some people knew that nature was very health promoting, and actually just in a recent study that a group did in Saskatchewan, that they found that going outside has been had the biggest positive impact. I think it was 33% they were adults, but of adults during the COVID-19 pandemic. And they found that connection, social isolation was one of the biggest detriments to mental health during this pandemic. So even looking at things, teaching or giving parents the tools, or how do parents come up with what they think is the best kind of way to care for their children or to promote their mental health. So these are just some of the constant things that came out. There's numerous others. But these are some of the things one of the big things that came up when parents were talking is that they are doing things by trial and error. And now with the pandemic, and I'm sure it's even greater, where they're kind of learning as they go. And some parents have a good grasp on, what they believe their children need, and others kind of really showed their worry and doubt in themselves. And so how can we, build the skills of parents, kind of hone in on what their strengths are, and then translating that to children. one of the things that we developed, not as a result of that, but just prior to that, a group of us decided to start a mental health professional practice group with the help of the SRNA. And we were initially looking at, and this is pre-pandemic, again, early in 2019, we started looking at nurses' mental health, and we found that the literature was saying that it's, there's a lot of burnout, caregiver stress, all of those types of things. So we started with that focus in mind. And I can type it into the chat later if anybody wants to check it out. But then we started to shift the focus and look at kind of more population mental health. And we've targeted different kind of areas, and kind of having a repository of information that hopefully could be helpful to someone. So that's kind of where we started, and we're still kind of developing it. So it's pretty bare bones. And as I'm the only web developer and I have no skills, so it is rudimentary, but we're hoping that we can kind of broaden it. And hopefully there's been so many resources that have now come since the COVID pandemic, and there has been a lot of focus on mental wellness. So this may not hold as much relevance, but certainly it's another tool that people can go to. I'm not sure why it's going backwards. And just some of the final thoughts, I think my time is up, is just that parents that I've spoken to across Saskatchewan are doing their best. They're stressed and struggling, some of them, specifically the ones I talked to during the beginning of the pandemic. But they have a lot of strengths and resources, and they really rely on the knowledge of within their community and others. So finding ways to, prior to help seeking, if there's anything that we can do or anything that it would be helpful even to have in physicians' offices, because we know a lot of times that's where people are accessing care. So I'm really hoping that while we're chatting and we think about, all the preventative things and all those kind of important things, looking at some of the things that are working, maybe how we can build on some of those good things that are happening, and then looking at other things, what supports are needed and what lessons has COVID-19 provided us. And I'm not sure if there is discussion room topics already, but these are just some ideas. And I don't know why it keeps going back to that slide. But anyways, I just wanted to thank everyone for giving me the time to present some of my ideas and thoughts. And yeah, I look forward to hearing the rest of the presenters. So thank you.